Good afternoon. Our March Wellness class is Focus on Feet, featuring Dr. Gina Mendoza. Her father was a local pediatrician for many years, Dr. Mendoza, obviously, and her brother's a local podiatrist, and she decided to follow in the medicine field because of a ballet injury that she suffered, or an injury to her foot that interfered with her being able to be in ballet. So she decided that she wanted to pursue that as her career. She's a local gal. She graduated from Beach High School, and she earned double bachelor's degrees in biology and graphic design from Western Kentucky University. Her Doctor of Podiatric Medicine degree is from Barry University of Graduate Medical Sciences in Miami Shores, Florida. She spent 1 year in surgery training at Hollywood Presbyterian Medical Center in LA and Camp Pendleton Naval Hospital in San Diego. She then acquired 2 years of surgical training at New York Methodist Hospital in Brooklyn, New York. During her training, she received several honors, including an Excellence in Podiatric Extension Clinics Award. And she's a member of the American Podiatric Medical Association and the Tennessee Podiatric Medical Association. She's also board qualified with the American College of Foot and Ankle Surgeons. And she has done volunteer work throughout the country, and when she's not treating patients, she enjoys many of the same recreational activities her patients do, including running, biking, weight training, and her all-time favorite, snowboarding. So we welcome Dr. Mendoza. In our previous class, most of the participants are either her patient or their parents, or she has a connection to the majority of the people in the class. So we do welcome and thank you for your time.
Well, thank you for having me here today. I just wanted to talk about some common foot problems that people might encounter, and they probably have some of these problems, but this by no means incorporates everything that I do in my practice. So I do trauma and many different things, but these are the most common problems. Okay. So, my number one problem that I see in my office is heel pain. So, I'm sure you have a friend, or you've had heel pain, or your brother, or your mother, or sister, somebody has had heel pain in the past. Usually, it's caused by plantar fasciitis or heel spur syndrome. That's the number one cause. And I'll talk about plantar fasciitis here in just a second. But some other causes of heel pain can include arthritis. If you have rheumatoid arthritis or any kind of other arthritis, you can have heel pain. Gout can cause heel pain, and gout is normally with joints, but it can cause some heel pain as well. You can have a nerve that's entrapped on the bottom of your heel, so that can cause some sharp shooting type of heel pain, but it's still nonetheless heel pain. A lot of people think that they've have a stone bruise or bone bruise. People come to my office and say, I have a bruise, which they might have a bruise, but it's usually just the plantar fasciitis, which I will address here in just a second. Usually, the causes of heel pain is all biomechanical. And what I mean by that, it's how your foot is functioning that's usually causing the problem that causes the pain. Sometimes you can have pain in the back of your heel, which is Achilles tendonitis. Or maybe you have a big bump on the back of your heel that rubs in your shoes, and that's a Haglund's deformity. So there's different causes and different locations for heel pain, but I'm going to talk about the number one cause of heel pain, plantar fasciitis. So basically, pressure, time, age, and weight, all these things can contribute to our arches falling over time. What happens when that occurs, you have little tears in the fascia on the bottom of your foot, and that can cause inflammation, and that leads to pain. Now, when I say fascia, the fascia is basically like a big ligament. It goes from your heel and it goes all the way to the ball of your foot to support your arch, so it keeps your arch up. That's why people have more of a problem early in the morning, because when they're sleeping, that fascia is nice and contracted, and then when they take their first step, it straightens out and flattens out again, and then you have the pain. usually conservative treatment for this problem includes, just an arch support. My patients in my office, what I normally do is I tape their foot up on the first visit when they come to see me. And this taping is a temporary arch support. So if I can eliminate pain with the temporary support, then I know that I can get rid of this with biomechanical treatment, so like an arch support. Sometimes, if that doesn't work, we have to progress to a steroid injection, a localized anti-inflammatory. Stretching, we teach stretching, and people can ice their heel, and shoe education is very important. So sometimes it's just the type of shoes that the patients are wearing that can cause the heel pain. So, and it may or may not be associated with a heel spur. It's very, very common for people to think, oh, I have a heel spur. Well, you may have a large spur and never any pain, or you might have a lot of pain and never any spur. So you don't need to assume that the two go hand in hand. So this is a picture of inflammation at the plantar fascia, which it starts on your heel bone, like I said, and you see that spur that's on the bottom. The spur kind of grows in the direction towards the ball of your foot. A lot of people think it's growing straight down, and that's not the case at all. So now let's talk about bunions. Now bunions are basically your big toe joint kind of goes out of whack. It comes in. We call that a subluxed toe joint. A lot of people think that it's an overgrowth of bone right in that area, and it's not. It's your joint that's kind of out of place. So basically, this is a hereditary problem. So somebody in your family has one, if you have one. So you're usually your mother, or your father, or your sister. Somebody has one. And you definitely inherited a foot type that predisposes you for a bunion. So in certain shoe gear definitely can cause an acceleration of the deformity, but you might be getting one anyway, even if you wear the right shoes the rest of your life. It's just that certain shoe gears can accelerate it. So some treatments for the bunion deformity include, of course, wider shoes. Stiffer soled shoes are actually better for bunions because it's usually the flexible, flat-footed people that develop bunions easier and quicker. So if their foot is allowed to do whatever it wants in a very flexible shoe, then they're more likely going to accelerate a bunion deformity. Sometimes bunion cushions can help. Steroid injections locally in that area can help, but I forgot to put one other thing on there. An arch support definitely will slow the progression of a bunion down, but definitely it's a progressive problem. It's just that all of these things are designed to kind of slow the progression down and eliminate your pain. But unfortunately, this is a surgical problem. If you have a bunion and it hurts and you really can't do your normal functional activity without pain, then we have to fix it. And that requires surgery. Let's talk about hammer toes. I don't know if anybody in here has a hammer toe, but a hammer toe is basically a tendon muscle imbalance. A lot of people ask me questions, how do I get this hammer toe? Well, there's many different causes for hammer toes. High arch people seem to have more of a problem with hammer toe deformities. Sometimes even flat-footed people can have a hammer toe deformity, and it all just depends on what their toes are trying to do when you're walking. These are different types of hammer toe deformities. That's the typical one up top. And then the next picture is, we call that a claw toe, where the end of the toe is also grabbing the ground. And then the mallet toe is at the bottom, and that doesn't happen very often, but you definitely see that type of hammer toe. So, like I said, hammer toes are largely genetic. High arch people definitely are more predisposed to developing hammer toes, and then flat-footed people can develop hammer toes also, but it's more of a stabilization of the ground when you're walking, and they usually only have a hammer toe on like the little pinky toe or maybe the fourth toe. Nerve damage can cause hammer toes if you have neuropathy. So the nerves that are innervating the small little muscles in your feet aren't working very well, and so they don't function to control the muscles that help to pull those toes down, and so that can cause the hammer toe. And certainly shoe gear, high-heeled shoes, if you're wearing high heels all the time, you put way too much pressure and body weight forward on the toes, and your toes have no room to function. So some of the treatments for hammer toes include, of course, a wider toe box shoe. If you have a very wide foot and you're wearing a shoe that does not fit your foot, then your toes are going to suffer. So a lower heeled shoe also is very important to wear. If you have too high of a heel, then that's a problem. I'm sure it's not going to be a problem for our, our firemen here or policemen. But usually if you work where you have to dress up, you need to wear a lower heeled shoe. Taping can help, but not everybody wants to tape their toes every day when they're going to work. And then, unfortunately, this is a surgical problem too. Sometimes we have to straighten out the toes. So, corns and calluses are definitely a big problem in my practice. The shoe gear makes a huge difference in prevention of corns and calluses. But basically, a corn or a callus is a hard skin that builds up in response to pressure. So if your shoes are too small for you, then the pinky toe gets a corn on the side, or maybe your toes are too squished together, you can get a corn on the inside. Or if you have that hammer toe deformity, as the last picture is showing, you push that metatarsal down, which is in the ball of your foot, and that can cause that last picture. Let's talk about ingrown toenails. That's a pretty sight. Basically, ingrown toenails are a big problem. And they happen a lot with kids in my office because there's a lot of kids that pick their toenails. And when you pick your toenails, you can actually cause up a problem with the sides of the nails, and that actually can cause the nail to grow in the corner a little bit more. So if you also cut in the corner, you're actually training the nail to grow in that direction. So it's a very bad idea to cut in the corners. You need to cut your toenails straight across. Sometimes, kids cut them too short, or people cut their nails too short, and that can be a problem. So you need to have enough room for your nail to grow straight out and be able to cut them straight across. Paronychia is an infection, and that's what that little guy is. Yeah, you don't want that. That can be very painful, but you don't have to have that presentation to have an ingrown toenail. You can have a lot of pain and not an infection, and you still might need treatment for that ingrown toenail. So prevention, like I said, trimming the nails straight across and no picking. So in my office, unfortunately, treatment includes a phenol matrixectomy, and that is the surgical procedure to remove the side of the nail that's digging in. And then what we do is we put a chemical that kills the cells that grow the nail on that side, so that side of the nail won't grow back. And we don't deform the nail, we don't take off half the nail, but we just take out just the side of the nail that's digging in, and that's very cosmetically pleasing to my patients, and then it goes away forever. Sometimes we have to take the whole nail off if the whole nail is infected, and then just let a new one grow back. Oh, there was another picture here that we didn't import, but but that's okay. Let's talk about fungal toenails. I'm sure that you've probably seen your grandma or your grandfather, and they've had some really, really thick yellow toenails. Not so pretty. When we get older, unfortunately, our immune system goes down, and so we're more likely to get a fungal toenail infection because the fungus is an opportunistic infection. So if your nails are thick or discolored or crumbly, you probably have onychomycosis. So some of the treatments are for fungal toenails can include some home remedies like soaking your feet in a dilute bleach solution. Now, it's very dangerous to do this because if you don't get the dilution perfect, then you can cause some dermatitis of the skin from the bleach, and that's not ideal. So I don't recommend my patients do this. You can go to the grocery store or the drugstore and find all kinds of topical medications. The problem is with the topical medications is that people don't have the patience for them. You have to use a topical medication twice a day for 3 months at least, sometimes even 6 months before you gain any benefit. Because what you're doing is you're treating the new cells that grow the nail. You're not really changing the appearance of the thick nail that you see. That just has to grow on out. And so it takes 6 months for a whole toenail to grow from start to finish. So if you don't give it some time with the medication, you're not going to see any benefit, and then you're going to be frustrated and you're going to throw it away. So some of the oral treatments for toenail fungus is Lamisil. So that's one pill that you take every day, and there are other pills that you can take out there, but this one is my favorite because it's the easiest. One pill a day, and you have to take it for 3 months. The only negative with this is if you're taking more than 5 medications other than Lamisil, I don't recommend that you take this product because it basically makes the liver work really hard. And so if you're taking a lot of medications that run through the liver, it can be dangerous. So I always send my patients for blood work to check their liver enzymes, and then every month that they're taking the Lamisil, I check their liver enzymes again, okay, just to be on the safe side. There's laser treatments for toenail fungus. There's a lot of doctors in Middle Tennessee that do have the Cutera laser. The only problem is with this is that it's not 100%. I want to say it's anywhere from 70 to 80% effective, and then it's very expensive. So each nail they charge for. So I don't do this in my practice, but some people have great success with that. And then the only 100% treatment for toenail fungus, unfortunately, is removal of the nail. So if you get rid of your nail, you don't have any more food for the fungus to live on, and then you solve the problem, but that's not always the best solution either. Warts. Now, I don't know why, but I have seen an increase in the amount of warts that I've seen in my practice in the last 2 years. So I don't know if it's hot yoga. I don't know if it's more people are going to the Y. I don't know if kids are, swimming or taking showers in communal showers more. But something's going on. And basically, a wart is a virus. It's caused by the human papillomavirus. So, and they're painful. So people that have calluses, calluses are painful and annoying, but they're not nearly as painful as a wart. A wart is very painful. So if you have a callus that's really painful, then you probably have a wart. Basically, when I look at a callus, I shave the callus down and I look at see if there's any skin lines missing. So on the bottom of your foot, you have all these skin lines, and if you have an absence of those skin lines in a certain area where that callus is, then it's probably a wart. Another way to tell if you have a wart is if you have these little tiny black spots in the callus. And people think that they are seeds. Well, they're definitely not seeds. They are your capillaries that are feeding the actual virus. So they come straight up to the surface and they look like seeds. So when I trim them back, you have little pinpoint bleeding, and that tells me that you have a wart. So some of the treatments that I do for warts, you can put a topical medication on. There are many different things that you can buy over the counter if you wanted to try something yourself. But I have a topical medication in my office that works great. Okay, I've found this product because I've been having a lot of warts come back. Unfortunately, these viruses, even if you cut them out, they can come right back. People have tried foot soaks, they've tried duct tape. There's many different ways to try to get rid of a wart. It's just that for the foot, the plantar wart on the bottom of your foot, the skin is the thickest on your body. So it's very difficult to get rid of these warts in my practice. But sometimes I have to completely excise them, which I don't like to do. You can freeze them, you can burn them. I don't do either of those. I either excise or I use a topical medication in my practice. So preventative for warts, basically, you can avoid communal showers without shoes. Of course, I always tell my patients to wear flip-flops or something if you're going into the Y and going into the showers. And when you're at home, if you do have a wart, you need to clean out your shoes and clean out your shower. So this virus likes to linger in dark sweaty, moist environments. Okay, so it's going to live in your shoes for a little while. So spray out your shoes with Lysol and let them air dry for about 8 hours before you stick them on your feet again, and then you're good to go. And then bleaching out your shower about once a month is advised as well. So I don't know if anybody here has ever had pain in the ball of their foot, but usually pain in the ball is caused by a neuroma. And some of the symptoms of a neuroma include burning, numbness, tingling, sharp shooting pains that goes in between two toes. Some cramping can happen. And sometimes the toes can spread out, okay? And that's kind of a weird presentation. Sometimes people have their toes just start to spread apart and they don't know what's going on. A lot of people complain of they feel like they're walking and their socks bunched up in their shoes and they don't know why. These are all symptoms of a neuroma. So basically what a neuroma is, it's a pinched nerve. So you have a lot of nerves on the top and the bottom of your feet. So when these nerves course up through to go to the toes, they get pinched in between those bones at the bottom, called your metatarsals here. Let's see if I can use this pointer here. So right here. So those are your metatarsal bones, and you have a ligament that connects all those bones together. And so the nerves typically course underneath that ligament, and they can get trapped and aggravated. So some of my treatments for neuromas definitely include padding and orthotics. Certain pads out there over the counter can actually cause more problems. I have certain pads that go behind the ball of the foot, which alleviates the problem. But if you put the pad in the wrong spot, you're going to aggravate the problem. So that's not good. Orthotics that hold the arch up and prevent patients from putting so much pressure on the ball of their foot definitely helps. Shoe gear modifications include, a stiff-soled shoe. If you're wearing a shoe that's very flexible and you're kneeling on your feet all day long, or you're doing some heavy lifting and you're always squatting down for your job, then that definitely can aggravate a neuroma. Sometimes we have to do steroid injections. So I do a series of 3 steroid injections in my office, and it does work wonderfully for my patients. And sometimes if that doesn't work, we can go to an alcohol injection, which is one more step before surgery. The alcohol is a way we try to cause atrophy to the nerve, so it shrinks down the nerve without having to go to surgery and take out that nerve. I don't like to do that, and oftentimes I can avoid it. Inner arch pain is also a big problem. So sometimes people have pain right in the middle of their arch on the side of their foot, and that we call posterior tibial tendonitis. So basically, you have a nice tendon that comes on the inside of your ankle, and it inserts on the side of your foot, and that is responsible for holding up your arch and letting us go up on our toes. Okay, so if you can't go up on your toes very easily from a standing position without pain, then you probably have some posterior tibial tendonitis. And if you can see this left foot here, this left foot is definitely deviated, okay? And so this posterior tibial tendon inserts right in this area. So if you have any pain there, then that might be what you're dealing with. The right foot is a straight foot, so that heel is in line with the back of your calf and your Achilles tendon. So that's what you want. So this might be something that's easily fixed with just a simple orthotic. So my treatment conservatively for this problem is definitely an arch support. Sometimes I have to give a local steroid injection, depends on how inflamed that tendon is. And, oral or topical anti-inflammatory products definitely work for this problem. So, and if you really have a problem on both feet, and I have a lot of kids that do have this problem, sometimes surgery is an option. And this particular picture shows an implant that I use in that joint below the ankle joint, and that's called your subtalar joint. And that just basically is an internal arch support. So it prevents your foot from rolling inward. So either you can prevent your foot from rolling inward with an arch support, or you can do so with something like this. And this is a nice implant because it's like a stent. It's just a space taker that's preventing excess pronation, which is that rolling in of your foot. So that's very successful in my practice. What's wrong with this picture? Anybody? Or exactly. First of all, the shoes are way too small. And it looks like a very non-supportive shoe. And if I had to venture a guess, this patient probably is a little overweight. So you have to really, really pay attention to the types of shoes that you're wearing and the kind of shoes that you're wearing. Now, if you go to Walmart, you're going to expect to get probably a Walmart product, which is not very good. And you're not going to spend a lot of money for it, but you're going to pay for it later. So this is not an ideal shoe for anybody. And then shoes that keep me in business are right here. I have a lot of shoes on here previously, but some of these pictures didn't show up through my website, so we had to just import these. But yeah, high heels keep me in business, and Crocs. Oh my goodness, the Croc craze definitely keeps me in business. So, there's nothing wrong with the Croc if you're using it as a house shoe, but if that's your primary shoe, then you're in trouble. And flip-flops. Flip-flops are terrible for you. They're not doing anything except preventing you from stepping on a nail, maybe. So, and that's it. I think I went a little quickly through that lecture. Is there any questions for me? That's my son. He is a little over 15 months old. Well, they're just not... Okay, I'm sorry. The question was, why are Crocs bad? Well, there's not much support with a Croc. And the support for your foot comes from the back of the shoe, and it has no back to the Croc, It's basically preventing you from... It's not holding your foot at all. So if your foot is doing whatever it wants to, then it's not supportive. So you really need a supportive shoe. It's just that people started wearing Crocs all the time, okay? And not everybody can wear a Croc all the time. So people are getting heavier. They're working all hours and they're doing a lot more, so these are all causing our arches to fall and all these tendonitis problems and flattening of the foot, and the Croc is not preventing any of that from happening. So that's why I don't like Crocs. Any other questions? Okay, the question is well, not specifically. Okay. Okay, she's talking about a specific high heel Jessica Simpson type of shoe that has a little bit of an elevated platform with it. Okay. Platforms in general are not terrible for you, okay, because they're stabilizing your foot. Okay, if you have a very flexible high heel, then you're doing more damage than you are by wearing a platform. So platforms I'm not going to poo-poo, but when you have a really high platform, then that's still a problem. You're still putting all your pressure on the ball of your foot, and then you're changing all the pressure in your back. Okay, so it's putting you in a different position. So I have more problems with patients that wear high heels their whole life and they never have a single problem with their Achilles tendon or their ankles or anything like that, and then they start wearing flat shoes all of a sudden. Okay, what they've essentially done is shorten their Achilles tendon over time, and then now they're asking their Achilles tendon to do a lot of work by wearing flat shoes. So they're actually better off in a little bit of an elevated platform type of shoe, but just not too high. And then on top of that, you could fall off of that and break your ankle, and that's not a good thing. So, any other questions?
The earlier class, you talked about flat-footedness and what the dangers were and about little children with flat feet.
Every child below the, I guess I need to repeat
Yeah.
that. The basic question was about flat-footedness. Kids are always going to be very flat-footed before the age of 4 or 5. That's completely normal, okay? So a lot of mothers bring their children in to see me because they, oh my God, my kid has a flat foot. Well, that's normal. Your foot is still developing, your muscles are still trying to do what they need to do, and you're just a bag of bones, basically, so you have a flat foot. So when they start getting above the age of 5 and you still have a very flat foot, then it is a good idea to get maybe like a kiddie orthotic for your child. But when I tell what I encourage my patients to do is to let the child run around barefooted before the age of 5 as much as possible around the house, as long as you have some decent surfaces or some carpet, or as long as they're not going to hurt their feet, they can walk around barefooted, because then they're going to strengthen the intrinsic muscles in their feet to allow them to develop a proper arch. Okay, so it's hard because flat-footedness is a problem, and a lot of people are flat-footed, but there's a lot of things that contribute to that. The shoes that we wear, the jobs that we have, the surfaces that we're walking on every day. We're walking on hard concrete and inhospitable surfaces for our feet. We're not running around in grass and sand and dirt, unfortunately. So we have to have the right shoes. And then on top of that, we're overweight, so we're putting way too much pressure on our feet. So that's causing even more flat-footed problems. So you just have to take care of the foundation, which is your shoes. So if you buy a cheap shoe, you're going to get a cheap outcome there. So, any other questions?
They have to go barefoot.
It's not. It's just not something that's recommended all day long. Yes. So I have a lot of housewives in my office that go flat-footed all day long, and they're the ones that don't realize the problems that they're having. It's like, when I was working all day long, I didn't have this problem with my plantar fasciitis or tendonitis or anything like that. And now they're at home, they're with their kids, and they think they can go flat-footed. Well, when they were working, they were wearing good supportive shoes all day long. And then they come home, and then they take off their shoes and go flat-footed. That's not a big deal. So the majority of the time, you really need to be supporting your feet. So.
Can you talk about the orthotics and the value of them, the ones you buy over the counter versus
Sure.
coming to your office and getting them?
So basically, I wanted to just talk a little bit about arch supports. Everybody wants to make money with the orthotics business. So there are a lot of places that you can go and spend a lot of money for arch supports. Be very careful. Now, I was trained on casting people for custom molded orthotics. There's a lot of places out there that claim that they give you a custom fit orthotic, but if they're not molding your feet, they're not giving you a custom product. So if you're spending hundreds of dollars for a prefabricated product that they pull off the shelf, run, okay? Now, most people, I should say, benefit from over-the-counter orthotics just fine. You don't have to have a custom molded orthotic, but it depends on where you go to get that over-the-counter orthotic. I sell over-the-counter orthotics in my office, and I also cast people for custom. Now, the over-the-counter orthotics, I would not waste my money buying anything at Target, Walmart, and Eckerd's. Sometimes they can help people, but usually they're space takers, and they're not really supporting your arch and doing much good for you. If you have too high of an arch and you buy something over the counter and it doesn't even meet the arch, then what good is that doing for you? It's doing nothing except taking up space inside your shoe and pushing your heel out of the back of the shoe. I always recommend, if you're going to invest in an over-the-counter product, you need to go to a sports store or tennis shoe store and get something there. You can either come to my office and I can evaluate your foot and see what kind of foot type you have and see what works best for you, and then I can recommend an over-the-counter orthotic either in my office or somewhere else. And then I also cast for custom molded orthotics. So custom molded is always going to be the best because it's casted specifically for you and it's a prescription. So I can alter that orthotic to whatever problem that you have. So a lot of people don't really realize that, but yes, that's the best. But it's an investment. They run anywhere from $350, and certain parts of the country you might spend $500 for a pair of custom orthotics. So, but they're definitely an investment, and they'll last years. So, any other questions? Nope.
Thank you very much.
Okay.
Good presentation.
Thank you.
You're more than welcome.